record the main session. We're only going to record the main session right now. The breakout rooms are now going to be recorded. We ask people to remain muted for the duration of the main session and the presentation. We will have time at the end for questions, at which point you can unmute yourself and ask your question after raising your hand. We're going to call on you. A lot of the questions and answers today are going to be in the breakout rooms. We have limited time for that during the first hour. So please keep yourself muted, and you can be on or off video for this first part. But I really recommend that you turn on the video for the breakout room so you can more actively participate. Next slide, please. At the same time, we don't want you to just sit there, right, and receive information. If you want to react in any way, shape, or form, we have the reaction buttons. The chat is open for comments and questions. We will try to address questions in real time as they come. And whatever questions we are not able to get to, we hope to follow up after the event. And what should you expect today? We're going to have this little welcome right now that I'm doing, and then we're going to have a check-in and who is in the room activity. Then we're going to have a DPH overview presented by our COO, Eileen Sullivan. And for the last hour of the event, we're going to be going to breakout rooms. So there's going to be 5 minutes of instructions right at the end of the hour with a 10-minute transition, so that we can then have a full hour in the breakout rooms. We heard last time that was something that people liked, so we wanted to really ramp up the time that's available there so that you can enjoy that as best as you can. And now we're going to go to the check-in activity and who is in the room with Brett Turner, our Public Health Workforce Evaluation Manager. Brett, the floor is yours.
Thank you, Ronaldo, and welcome everyone. For those who are here on Tuesday, welcome back. I'm glad to see some faces that I know were here on Tuesday. So if you're here Tuesday, you know that this sort of check-in portion will be interactive, and I'm going to put a link in the chat. And I ask that you please click on the link and just navigate to the Mentimeter page that will open so that you can provide some responses as we go through a check-in together. Again, my name is Brett Turner. I'm the Public Health Workforce Evaluation Manager here at DPH. So, perfect. I see some folks have already opened the link. Again, at DPH, we like to begin sessions like this with a check-in to acknowledge the many ways in which people are arriving to this space. You are living, thinking, feeling people, right? And at 2 o'clock on a Thursday, you might be at work. You might be coming here from school or somewhere else. And there are a lot of cameras off. I imagine someone here is on the bus. Right, so we're in all sorts of different places mentally and physically, and just want a quick check-in on how you are feeling. And I'm going to take over the screen share and start sharing so that you can see how others are arriving into the space. Great, we have 40 responses. Fantastic. That looks like folks are able to access Mentimeter. Let's see. Broad range of feelings, of emotions, of physical states. Folks are excited, folks are feeling interested and curious, but also feeling tired and nervous. So I just want to sort of honor and recognize the different places that you're in. And thank you for taking time, no matter how you're feeling, for being here today. Fantastic. We're at 55 responses, but we have 90 people in the room. I know there are a lot of DPH staff here. I'm going to wait just a couple of minutes so that folks can get started with Mentimeter. Again, the link is in the chat, which will get you to this interactive check-in. Folks feeling cold? I feel that today. I saw we were in the 30-degree, space this morning when I left my apartment. That time of year. People feeling good, feeling relaxed. Excellent. Feeling full. We're after lunch, so you're feeling full now. You might be feeling tired soon. Thanks for sticking with us. Excellent. At 61 responses, I thank you for your check-in. I'm going to move on. I do have a few more questions for the room. So the other day we asked you what you thought about state public health, but today I just want to ask folks, what attracted you to the field of public health, right? You could be in an open house for any industry, any sector. There's some reason why you chose to be here today. And for those of you who are getting an MPH, you may very well have chosen that for a specific reason. I want to hear just what drew you to the field of public health. got 2 responses. So folks might be thinking, excellent, here it comes. When we get to, let's say 50, I will show what's on the screen just so that we don't have sort of contagion of ideas here where one person says something and then everyone has the same word. Thank you. And while you fill this out, I'm just going to drop the link again in the chat. For folks who have just arrived, we are doing an interactive check-in. Quorum, thank you. Quorum has just dropped a link in the chat. I'll drop the link alone without any text. It might make it clickable, I think. Please click on that link and then you can join us and contribute to this interactive check-in. Here we go. So these are words, 1 to 2 words that you put in, which explain what attracted you to the field of public health, prevention, service, public service, right? To help people, work on infectious diseases. Some are inspired by classes taken in undergrad. You want to serve underserved populations, do meaningful work, address health inequities. Some folks looking for a career change. You're doing something else and now you're feeling inspired towards public health. In the chat, I see that you believe in preventive health and health for all. And so after becoming a doctor, you wanted to work in public health in India. Thank you. Amazing, 92 responses. Thank you all so much for your engagement here. I see the responses have slowed, so I'm going to move us to our next prompt. And actually, before I show the next prompt, if you were here on Tuesday, you'll remember this, but we want to get a sense of who is in the room with us. We're interested in just recognizing the diversity of who's in the room today, for you all to know who you're sharing the space with. But on the DPH side, we want to know who we are and are not reaching with our open house events. So your responses to these upcoming questions are, of course, anonymous. There's no way for us to connect what you say here to your registration to this event or your Zoom or anything like that. I just want to get a sense of who is in the room. So to get us started, first question, were you here on Tuesday? There's some folks who are here for the first time. There's no wrong answer. We totally recognize that you may have only been available for this session. Fantastic. At least 35, 36, 38 of you and climbing. We're here on Tuesday where we covered topics related to the hiring process and sort of guidance around the application process. Really glad that you could be here again today and recognize that some folks could not attend. That's totally okay. We will be sending a recording, as Arnaldo's saying in the chat, of Tuesday's session. So if you want to benefit from the resources shared in that session, there will be a recording sent out to all registrants. Fantastic. It looks like responses have slowed here, so I am going to move on to the next question. Thank you for your engagement. So here, just please select those categories which best describe your racial identity. You can select more than one category. On Tuesday, we had representation from all of the categories here, which I was proud to see. Let's see, I see we're very broad coverage today. "57 responses. We had 90, but I suspect some of you were double responding to the earlier word cloud questions. So I'm going to wait just another couple of seconds as folks finish this question. And again, for people who have just joined, I'm going to drop into the chat a link that will take you to the interactive activity that you see on the screen now. We're just doing a check-in, getting to know who is in the room. Fantastic. Thank you all. Switching over to percentages. I'm going to move us to our next question just so that I can keep us on time for our event. I know folks want to get to those breakout sessions and also hear about the DPH overview. So just a question, use the categories here to indicate which of the following best describes your gender identity. You can get to percentages here. There we go. Wow, 83% identifying as woman or female in this session. We are at 64 responses. That is an overrepresentation, even relative to the field of public health and relative to DPH. Overrepresentation of folks identifying as female or women, or in the sort of inverse of that is an underrepresentation of men and folks who are identifying as non-binary. At 66 responses, I will keep us moving. So the question here, do you identify as having a disability? This can include a physical or mental or other disability. Excellent. We, of course, want to make sure that folks with disabilities, folks of all ability levels, see DPH as a potential place to work, feel invited and welcome to a session like this. Thank you all very much for your response. Great, 59, so quick. Excellent, excellent. I see as response is slow, I think I will move us to close to the end of our prompts here. Are you a veteran or are you currently serving in the U.S. Armed Forces? Any branch of the military? Are you currently serving? Are you a veteran? One veteran. We had two veterans, I believe, on Tuesday. Thank you for your service. Fantastic, fantastic. I see responses slowing, and we're getting around the 62, 63 number where things tend to freeze up. So I'm going to move us to our next slide. We asked this question last time and a broad range of backgrounds. Have you had a job or internship at a Department of Public Health? Not necessarily Massachusetts, maybe in another state, maybe in a local health department where you're from or where you live. Great, there are folks here who have worked at health departments in the past. There are folks here who have had internships. Fantastic. I'm going to drop the link in the chat that you can use to navigate to this interactive check-in. You can respond there. Thank you so much. But most people have not, right? So hopefully you will find whether you're at another health department, which functions totally differently than this one, or you've not worked in state government or at a health department before, I hope that you find that after this session, you have a better understanding of the sort of workings or the structure of DPH at least, and how to navigate applying for jobs here. Fantastic. I will move us. Do you have formal training, a bachelor's degree or a master's in public health, or are you pursuing a doctorate? If you're currently pursuing a degree, like you're in an MPH program, then just indicate the degree that you're currently studying for. And I just want to emphasize here that this is not to say that a public health degree is necessarily a requirement or even an advantage when applying to DPH, right? Public health is an interdisciplinary field. We need people with a broad range of training to support all the different work that's happening here. So really great to see that there are people with a diversity of training with and without formal public health training in the room. There are, the ratio here actually is more formal public health training than we see among staff at DPH, right? So just to know that internally DPH is a broad variety of training, and it's not just public health specific training. And lastly, want to hear just what's something you're hoping to learn today. We asked this question last time, but the last session was focused on application process, and today, today we have a different focus. So just want to hear what you're hoping to learn today. The many facilitators here, the breakout session leaders, can kind of get an eye for what you're hoping to hear about, and hopefully we'll be able to attend to all of it during this session. How to get a foot in the door, right? You want to learn about how Mass DPH works. I think you're going to get a little bit of that in the segment that is following this. How to make your application stand out. Yes, and if you weren't here on Tuesday, you'll want to review the recording of the Tuesday session where we cover some of that information. But how do you stand out in an application process? How do you get jobs out of undergrad? Where would your skill set maybe be most aligned with needs? Really fantastic questions here, and I hope that you find this session answers some of those questions. Fantastic, fantastic. What are each of the departments' work, right? Because there's so many branches within the Department of Public Health. It's hard to know what do they all do. What opportunities exist? What are the inner workings of the hiring process? Fantastic. Definitely review that session from Tuesday, but you'll also get some insights today, I hope. And that is the end of the presentation, the interactive check-in. Thank you so much. I'll now pass to DPH's Chief Operating Officer, Eileen Sullivan, who's going to give an overview of DPH.
Thanks, Brett. Welcome, everybody. So glad to see so many people here, as well as DPH colleagues who are helping with the event. And we have some PowerPoint slides we're going to go through. Okay. So this slide shows the wide range of things that happen at DPH. I actually came to DPH over 24 years ago. I never thought I'd be saying that, but I came to DPH to do tobacco policy and prevention work back in the last century, 1999. And after about 12 years of doing that work, I moved to the commissioner's office. I've been in my current job for about 8 years. And what's really wonderful about DPH is the wide range of work that we do. What we do has an impact on people's lives every day in the Commonwealth. Sometimes it's invisible when we do our work well, but we have an amazing impact here. And that's what's really kept me here all of these years, is the work I've gotten to do myself and the work that I've gotten to support my many colleagues in doing. So this just gives you a little sense of everything at DPH, and we'll talk in a moment about a few more specifics. Next slide. So our vision is a really important vision, which is to have the optimum health and well-being for all people in Massachusetts, supported by a strong public health infrastructure and a healthcare delivery system. Now, I will say this is a wonderful vision, but we are in the middle of improving it. We are, as you are probably aware, in the middle of a new administration with Governor Healy coming into office in January. So with new leadership, we've been going through a process of looking at our strategic priorities and updating our vision and our mission. We also are, within the next month, going to be officially launching our racial equity strategic plan, in addition to our overall public health strategy map. So very excited about the improvements to come. Next slide. I think we skipped, is there the mission slide? There we go. So our mission, after we have our vision, is to prevent illness, injury, and premature death, to ensure access to high quality public health and healthcare services, and to promote wellness and health equity for all people in the Commonwealth. And our guiding principles is how we do that work. So there's the 3 Ds, as we like to call them. There is the importance of data, which really drives our work. We provide relevant, timely access to data. That data is used by our own staff, by researchers, the press, general public, in an effective manner in order to target disparities and impact the outcomes. There is no point in us doing a data report if it can't be used by people to make improvements in people's lives. And we have really worked hard, particularly over the last 9 years, to get our data out more quickly in easily understandable formats. It used to be we would produce these really, really big reports. It would take a long time. The data would be out of date by the time the reports came out. And the average person had a very hard time using those reports compared to the formats we use now, which are a couple of pages, and really point to how the data can be used to improve people's lives. We look at determinants, meaning social determinants, the conditions in which people are born, grow, live, work, and age, really contribute to health inequities. And we need to look at those determinants and work with other people focused on those in order to make changes. And disparities. So we consistently recognize and strive to eliminate health disparities among all populations in Massachusetts, wherever they may exist. And this really is the core of our work. Next slide. So the 5 foundational public health strategies were just implemented within the past couple of months. We were very excited in April to have a new public health commissioner, Dr. Robbie Goldstein. And he very early on in being at DPH, he established these foundational strategies. The strategies will be more apparent when we release our strategy map in the next month or so, but I'm just going to touch on them very briefly. So leading emergency and preparedness and response is really the important role that public health played, which you would have seen during COVID, but other types of emergencies as well. We look at emerging infectious disease, biothreats, natural disasters, climate change, threats to reproductive health and gender-affirming healthcare, racism, and violence. And again, what can we do to be prepared and to respond effectively when those situations occur in Massachusetts? Strengthening our public health workforce, which we hope some of you will join, is a really important part of our work. We can't meet our vision of having optimum health and well-being if we don't actually cultivate the optimum health and well-being of our own staff. And we are committed to developing a competent, compassionate, diverse workforce in ways that support health and well-being and build capacity to lead with a racial equity first approach. We are luckily recently have received some significant federal funding, which really allows us to focus on some workforce initiatives. And then modernizing the public health infrastructure. So this refers to both equity-centered data modernization and data sharing efforts, our operational systems and services, and actually renovating and replacing physical plants in ways that advance the health equity and knowledge of the impact of place and space on community health. We are in the middle of renovating while we are using it, our state laboratory, which is an incredibly important project. And then enhancing public service. So this really refers to the importance of fostering public trust through high quality program delivery, streamlined public engagement and partnerships with those most impacted by health inequities and emergent threats to public health. And these foundational strategies form an interdependent and unified approach rather than having work that is very separate. So we are, as I said earlier, finalizing a strategy map that will be made public, I believe in December, and will bring these concepts together more. Although whoever's doing slides, I think we missed the slide with the bureaus. Can we go back to that? And then I'll come back to the map. I think something got out of order a little bit at the end. Thank you. So I'm going to talk for a couple of minutes about all the wonderful work the department does. And we are structured in a way where we have some functions in the commissioner's office, and then we have a group of bureaus and a group of offices. And we often have staff, as I described myself, will work in one area and then get promoted and move to a job in other parts of the department. So the commissioner's office has functions that include our academic health department, communications, finance, general counsel, which is our legal services, human resources, legislative affairs, operations, performance management, policy, regulatory affairs, and staff training and development and workforce development, which is sponsoring the session today. The commissioner's office works to support the entire department in really critical ways and to organize strategy and policy approaches across the department. Most of our staff work in one of our 8 bureaus. And a bureau basically means that it's a group of programs that have a similar focus area that are working together. And as you can see, we have 8 different bureaus here. So the Bureau of Community Health and Prevention includes a number of important programs that range from asthma to cancer control, tobacco, community health workers, reproductive health, injury prevention. It really is a bureau that has so many different functions. It's challenging to list them all quickly. But they do a wide range of work that directly impacts our community partners and fund a lot of very important programs. The Bureau of Climate and Environmental Health actually recently got renamed, as you may be aware. Climate is a very high priority of Governor Healy. And so some additional funding has been identified for this bureau and to really enhance their focus on climate-related issues. And they have done this work for many decades, but now have some additional resources and focus on it. In addition to climate initiatives, they also have regulatory functions around keeping our food supply safe, radiation prevention, community sanitation, lead poisoning, particularly with children prevention, keeping our beaches safe, monitoring the water, and a wide variety of research and surveillance type of activities. In the Bureau of Family Health and Nutrition, we have several very large federally funded programs, including women, infant, and children, and early intervention, as well as extensive work around children with special healthcare needs, monitoring birth defects, and maternal and child health. In the Bureau of Healthcare Safety and Quality, that bureau really strives to ensure that the healthcare facilities that we all use provide safe, effective, and health quality care. So that would include nursing homes, hospitals, and other healthcare facilities that we inspect. It also includes our nurse aid registry for all of the people in the Commonwealth who work as nursing aides in hospitals and nursing homes and other locations. They also have OEMS, which is the Office of Emergency Management Services, which regulates and educates EMTs throughout the Commonwealth. So every ambulance that is going to support somebody and the staff who are in them are part of that, that group that is regulated. The Bureau of Health Professions licensure focuses on individual professions. We have a series of 21 boards which license different professions, ranging from nurses to pharmacists to community health workers, to dentists, to social workers. And each licensing board has responsibility for licensing the profession, as well as providing education and support for times when people struggle, for example, with a substance use problem that interferes with their ability to be able to do their job. So there's a wide variety of work that happens in that bureau. And together, they really make sure that our healthcare system is safe and effective. The Bureau of Infectious Disease and Laboratory Sciences tracks, tests, and tries to prevent infectious disease. We have 13 separate laboratories with our laboratory professionals, including microbiologists and chemists, performing testing, everything from COVID to rabies. And again, this is really critical to identify when an outbreak is about to occur, as well as responding to more routine issues. They also do extensive prevention education, particularly around issues of working with immigrant populations, around tuberculosis prevention, working with HIV, Mpox, and other sexually transmitted diseases. The Bureau of Substance Addiction Services oversees our statewide system of prevention, intervention, treatment, and recovery support services for individuals, families, as well as community prevention. We have been doing some really innovative programming around harm reduction, and also are very proud of our very substantial treatments that are available in Massachusetts. The Bureau of Public Health Hospitals does very different work, and you can see our 4 hospitals listed here. This is actually about half of our workforce, and we are the safety net for the Commonwealth. So we have 4 specialty hospitals that provide acute and chronic medical care to individuals who can usually not be served in traditional hospital settings. This includes people with significant behavioral issues, developmental disabilities, as well as people who have been in the correction system. All of our hospitals are accredited by the Joint Commission, and again, we serve an incredibly important safety net function. On the right side, you see the offices. I think of it as a bit of a matrix. The majority of our staff are working in bureaus, and the offices really kind of serve all of the bureaus around specific areas, such as coordinating with our partners in local health or health equity. So in our offices, we have a smaller number of staff, and they usually are very focused on the particular area in which they are kind of the liaison for the department to the rest of the bureaus and our outside partners. Our Office of Local and Regional Health works with our 351 municipalities in Massachusetts. We have one of the most decentralized public health systems in Massachusetts. And so our Office of Local and Regional Health provides funding to municipalities through 51 different shared services, but they also work individually with each of the municipalities who need support. The certification for registered sanitation and health officers are also managed through the office, as well as a very extensive workforce development program to support our local partners. Our Office of Preparedness and Emergency Management coordinates our work in terms of working with both local health and with the healthcare system to prepare for disasters, outbreaks, and large-scale emergencies. They also manage a health and medical coordinating coalition, which every town and healthcare facility in the Commonwealth belong to one of those coalitions. The Office of Population Health was established just a few years ago in 2017 to really ensure that we could accelerate the use and dissemination of data and advanced analytics across the department, with a real focus on identifying disparities in health outcomes, risk factors, and the social determinants of health. Among other things, it manages the Population Health Information Tool, which many communities use for local data to compile health assessments, improvement plans, and to understand what the highest risks are to their community. Our cancer registry and our registry of vital records are also in the Office of Population Health. The Office of Health Equity used to be part of the Office of Population Health, but Commissioner Goldstein decided shortly after his arrival to separate that and make it a standalone office because this was such a high priority for him. Our Office of Health Equity works to address social determinants so that everyone in the Commonwealth can attain their full health potential. The staff work on promoting principles and policies that form the way health services are designed and delivered. We recently launched in the past year a community engagement unit that focuses on supporting authentic community engagement throughout different by focusing on different populations. And we also have the culturally linguistic and appropriate services or class program and a health and disabilities program within that office. In a slightly different category and being a little bit more specialized is our Vaccine Equity Initiative, which, as the name says, is really focused on getting all populations to understand the importance of vaccination and try to work with communities to overcome a lot of the disinformation that has been out there, especially since COVID. While they began to really focus on COVID, they are now focusing on a much broader vaccination mission. But COVID, of course, remains a very high priority. Our Office of Problem Gambling is actually incredibly unique. We're the first, and I think still one of the very few states that has a requirement that some of the tax revenue from casinos and other forms of gambling come to the Department of Public Health so that we can work on prevention and treatment around this area. So this is very important work that crosses over multiple issues, since the impact of gambling can also significantly influence substance use, domestic violence, and a wide variety of other issues. And last but certainly not least our State Office of Pharmacy Services is an integrated medical distribution system that supports other health and human service agencies to ensure that we get the lowest cost by bulk purchasing, to make sure that everybody who is being served by the state, whether it's mental health or developmental disabilities or in a sheriff's correctional unit, is able to get the medication that they need to stay healthy. So that is a lot of information. Hopefully in there you heard some words and some programs that speak to you as wanting to be part of some of the work that we do. There is extensive information, available on our website about all of our programs, and certainly in the breakout groups, people will be able to answer some of your questions as well. If we can just finish up with the map, this just shows where our offices are located. So for most of our staff at DPH Central, with the exception of staff in the laboratory and some people who are still doing work such as reception or work that is very paper-based, the majority of our staff at DPH Central are able to do some hybrid work, meaning doing some work at home and some work in the office. Today, I'm in our main office, which is at 250 Washington in Boston. We have several other locations in Boston, including our state laboratory in Jamaica Plain, our Vital Records, which is located in Dorchester, and several offices that are around the state, our largest office being in Marlborough, which is somewhat centrally located. And then we have smaller offices in Westfield, in Tewksbury, in Canton, and in Wakefield. So when you look at a job posting, you will see a particular office that you are assigned to, but some staff, depending on their work, will also spend time in other offices. So this just gives you a sense of where we are located. And with that, I believe I will turn it over to Ronaldo to talk a little bit more about the specifics of applying for jobs at DPH.
Hi, everyone. Arnaldo Machado here again. If you were not here at the beginning of the session, I'm the Director of Public Health, Workforce Development, and Resilience, and I go by the HE series. I want to call your attention to this slide in front of you. It's an awesome opportunity for you to use your phone or to copy that link, enter that link on the browser, and look at our careers website. We ultimately want to do these events to get you there, right? And to know how to apply for jobs and to better position yourself so you can secure a career in the department. So hopefully I'm speaking to my future colleagues here. At the Tuesday session, and the recording for Tuesday will be shared with all of you in a follow-up email. We talked about the process of applying. Mass Careers is our main portal for applications is our portal for applications for jobs at the department. And we talked about the 14-day rule. So if a job opens, you're better positioning yourself if you apply within the first 14 days. After the first 14 days, it is likely that the hiring managers are already moving forward with interviews, and there is a chance that you may not be contacted. Although some hiring managers will allow a little bit more time, or depending on how many people respond to a job. So usually between 14 days to a month is when, before 14 days, but then up to a month is when you really want to make sure that you get your application in. So if you're going into the site and you see a job from 6 months ago, you might not want to necessarily go to that one. That selection process is already probably in progress, and it is likely that you will not be contacted for that one. So if you don't remember anything else, remember the 14-day rule. It is a way to get to get your application prioritized. More information on our recording that's going to be shared for Tuesday. And I also want to mention that while you may not reside in Massachusetts, if you're willing to move to Mass, please continue to apply for our jobs. But there are also other portals available nationwide, and one of them is the publichealthcareers.org. There you can find many public health jobs there. This is a website that was created last year. ASTO, the Association of State and Territory Health Officials, has really promoted this website, and there are many, many jobs outside of Massachusetts there if you wish to visit, apply, and look. And in the next slide, I want to introduce you to the internships information hubs. There is a internships at DPH website that's going to have all the information about our internship programs. Some of them are run by our Bureau of Infectious Disease and Laboratory Sciences, but some are also handled more centrally at DPH. These are good sources of information. You're going to find information there about how to apply for internships, when to apply, and all of the process. And then the Academic Public Health Corps is another program that's there. It is a paid program where students are encouraged to conduct their practicums for school at the local level. So you would be working at local health departments and getting that experience that's so needed, both for your degree, but for your career as well. So if you are here for internships, there is going to be a whole breakout room just about internship programs. So I would recommend that you join that one. And you're going to hear from the people that are running these programs. And we even have a representative from the Academic Public Health course here today. So you're going to hear right from the source. We can now probably move to the questions portion. I will ask that questions related to internships be saved for the breakout rooms. And we're also going to have breakout rooms on data analytics, epidemiology, nursing, program management, and administration. So if you have specific questions in those areas, please save them for the breakout rooms where you hear from the people that know it best. But we can also open it for a few questions right now. We have about 4 minutes. So maybe 1 or 2 questions. Any questions? If you don't have any questions, I have a few questions from the registrations form. So I'm going to give you a few seconds. Please raise your hand if you want to ask a question. Could you clarify? Thank you, Jordan. Could you clarify whether you need to be a Massachusetts resident in order to work from Massachusetts DPH? If you are working physically in a location, if you're applying for a job that says the hybrid work is not an option, you certainly want to be within driving distance of that location. And what we mean by driving distance usually is within 2 hours. If you are working in a hybrid setting and the posting right at the bottom says hybrid is available, you still want to be within 2 hours of any of our locations. So you could be in Massachusetts or in a nearby state as long as you are within 2 hours of one of our offices. Eileen, is there anything to add on that question?
No, I would just say we do have a number of employees who live in Rhode Island, New Hampshire, New York, close to the border. You just need to be able to get to the location in a reasonable time period.
All right, and we have another question from Rukmini. Thank you so much for your asking. Any advice for getting back to public health after a break? My best advice is get back to public health after a break. You really should be able to come back. We're looking at, if you took a break and you engage in another career, there are many of transferable skills that are going to be very valuable for the department. So we would love for you to bring that background with you, right? There is no one career path to public health. As long as you end up here, you're welcome. And just make sure you're applying for a job that speaks to the skills that you have. You may have noticed in all of the handouts that we sent out, even the speakers promo, all of our academic credentials are listed there for a reason. You can see that people have bachelor's in science, completely unrelated master's degrees, certificates, or doctorates, and all of us are here, right? So we want to highlight that there are different ways that bring you to public health. So I really want to emphasize that. And we have time for a couple more questions. We're doing better with time than I thought. Internship opportunities, that question is going to be from the internship room. If you want to start working after graduating in 2024, when should we start looking for available jobs? We have available jobs at the entry level. You may have a little more competition there, but certainly if you feel that a job speaks to you, I would say do not get discouraged from applying. I think that there are many opportunities at the local level that you might want to look into as well, or nonprofit organizations, advocacy groups, many organizations that are involved with public health. So look at DPH, look outside. As long as you're engaged in public health and you're getting your experience towards a career in public health, you will be welcome. And Eileen, I saw you unmuted yourself. Do you want to add?
Yeah, I just wanted to add to that. If you're looking for a timeline, our hiring processes in state government are a little bit lengthy. So usually, it can take from the time that you apply to when you get actually on the payroll, can take about 6 to 8 weeks. So, I would not be applying for a job in January if you're not available till May, but, to be, probably looking in, 6 to 8 weeks before you're available to start.
Thank you very much, everyone. I'm going to wrap up the questions here because, in fact, I'm 5 minutes over, and I just realized that Miranda Lombardo is now going to speak to our breakout room instructions, and we will have a 10-minute before 3 o'clock where those transitions are going to happen. Miranda Lombardo, our onboarding and technical training technician, and I may have missed a word there. Our titles are very long. Miranda, the floor is yours.
Thanks, Arnaldo. Good afternoon, everybody. Welcome. As Arnaldo mentioned, my name is Miranda Lombardo, and I am the training and onboarding technician for the Commissioner's Office here at the Department of Public Health. I'm very excited to have you here. So what I'm going to be reviewing today with you is our breakout activity. So the breakout rooms will be opening up shortly. We will have a break once the breakout rooms do open. So presentations will not start till 3 p.m. So that will give everyone time to get into their breakout rooms in case there's any technical issues that we need to sort out as people are going in. So please do not worry about that. In each of the different breakout rooms, as you can see here, you're going to hear from current DPH employees in the specific job area that you're interested in. Please make sure to type any questions you have in chat. If we are not able to get to those answers in chat, we will definitely follow up with an email if we're not able to answer them live. And you are welcome to turn your video on now if you would like, but please continue to remain muted unless you are called on within the room to unmute yourself. As Arnaldo mentioned, we will have 6 breakout rooms that you'll have available to choose from. We will have the administration, data analytics, epidemiology, internship, nursing, and program management. You will be able to jump in between each of the different rooms if you would like. All presentations will start at 3 p.m. So if you're looking for certain information, I would suggest jumping into that room in the beginning. And then you can always jump into another room later on if there's specific questions you have for one of these specific programs. To access each of the different breakout rooms, when we open the breakout rooms up, you will see a breakout room icon on the bottom of your screen. As you can see here, it has 4 squares. Just click on the 3 dots for more. If the icon is not easily available, if you have a lot of icons there, sometimes it's not displays. And then once you get into there, you'll see the 6 different breakout rooms listed. Just select the breakout room you'd like to do by hitting the join button. If you do wish to join another room, please be careful about which button you are hitting. Please make sure that you choose the leave breakout room and not the leave meeting button. Also, you are free to return to the main room if you have any questions or if you're running into technical difficulties. I will be here along with some other technical support staff to assist you in getting into the breakout rooms. If you are having issues or any audio issues, we can work with you on that. And as I mentioned, breakout room presentations will begin at 3 p.m. We'll be opening up the breakout rooms now. So I'm actually going to stop sharing my screen. So feel free to please jump in, and presentations will begin at 3 p.m. And please stay in the main room if you have any questions. Thank you, everyone.